Doctor, I'm worried about this rash on my leg. It's red, swollen, and feels hot to the touch. It's even starting to blister in some areas.
I understand your concern, Mr. Smith. Tell me, when did you first notice this rash?
Just a couple of days ago. It started as a small red area, but it spread quite quickly. My leg feels tight and painful, and I've been feeling a bit feverish and unwell.
Dr. Jones carefully examined the rash, noting its distinct raised border and the surrounding inflammation. Based on Mr. Smith's symptoms and the appearance of the rash, Dr. Jones suspected a common but potentially serious skin infection called erysipelas.
Mr. Smith, based on your symptoms and the examination, it appears you may have a skin infection called erysipelas. This condition is characterized by a sudden onset of symptoms, including fever, chills, and a red, swollen area on your skin that feels warm and tender to the touch. It's a type of cellulitis but more superficial, affecting the upper layers of the skin. It's important to remember that this is just a preliminary assessment and we'll need to run some tests to confirm the diagnosis. These tests might include a blood test to check for signs of infection or a skin biopsy to identify the specific bacteria causing the infection.
Erysipelas is a bacterial skin infection usually caused by Streptococcus bacteria. These bacteria are commonly found on the skin and in the throat, and they can become problematic when they enter the body through a break in the skin. These bacteria can enter the skin through cuts, insect bites, or other breaks in the skin's protective barrier. Even minor injuries, such as a scratch or an insect bite, can provide an entry point for the bacteria. Once inside, they multiply rapidly, leading to the characteristic redness, swelling, and pain associated with erysipelas. The affected area may also develop blisters, and the edges of the infection are often raised and sharply demarcated from the surrounding skin.
The good news is that erysipelas is treatable with antibiotics. The type of antibiotic prescribed will depend on the severity of the infection and the patient's overall health. In most cases, oral antibiotics are sufficient, but severe infections may require intravenous antibiotics. However, it's crucial to begin treatment promptly to prevent potential complications. If left untreated, erysipelas can lead to serious health issues, such as abscesses, blood infections, or even the spread of the infection to deeper layers of the skin and other parts of the body.
Mr. Smith listened intently, absorbing the information. He understood the importance of following the treatment plan and attending follow-up appointments to ensure the infection was fully resolved. He was relieved to know that the infection was treatable, but also concerned about the potential complications Dr. Jones had mentioned. He asked about ways to prevent future infections, and Dr. Jones advised him to keep his skin clean and moisturized, avoid scratching or picking at the skin, and promptly treat any cuts or insect bites to reduce the risk of infection.